Welcome back, everyone, to the deep dive. AI in healthcare, it's everywhere right now. We're diving deep into that today.
Yeah, it seems like everyone's talking about it.
Definitely. And our source material today, a blog post just out today, AI in Healthcare, Transforming the Future of Medicine by Jose Cordero, December 8th, 2024.
Oh, I saw that one. Came across my desk this morning.
Yeah, and, the potential here, it feels huge, right?
Yeah.
But, what does it actually mean for, for us? For patients.
Well, that's the big question, isn't it? I mean, Cordero really lays out some pretty remarkable applications, 7 key areas where AI is already making a difference.
Okay, so let's hear it. Hit us with those 7.
Okay, so we've got early disease detection and diagnosis, personalized treatment plans, patient monitoring and management, medical imaging and radiology.
Okay, keeping up. Keep going.
Okay. Drug discovery and development, virtual health assistants, and finally, administrative workflow optimization.
Wow, that's a lot to unpack.
It is, but when you look at it, they sort of cluster around some key themes. Like, take those first 3. Early detection, personalized treatment, patient monitoring. It's all about, a more proactive approach to healthcare, right?
Interesting. So instead of just reacting to illness, AI could help us stay ahead of it.
Exactly.
I like that. Big fan of preventative care myself. So that's promising.
Absolutely. Imagine algorithms analyzing your genetic data, lifestyle, medical history,
Okay.
to predict, your risk for certain conditions years before they might develop.
Wow, that's wild. Like a personalized early warning system.
Basically, early intervention could drastically change outcomes. And then, we've got those personalized treatment plans.
Yeah, that one's really intriguing to me. How does AI actually tailor treatments to an individual?
Well, imagine taking medication that's precisely calibrated to your body's needs. Minimal risk of side effects.
That would be huge. Have you ever had, bad side effects from a medication?
Oh, yeah. It's not fun.
No, it's not.
But AI could use, your genetic profile to predict how you'd respond.
Huh. That could be a game changer. Speaking of changing the game, Cordero had those scorecards for each application, right?
He did.
I'm curious how those stack up. What's really leading the pack?
Well, medical imaging, personalized medicine, virtual health assistance, and patient monitoring. Those scored exceptionally high.
Why do you think those are ahead?
Well, it's a few things. Technological advancements for sure. Data availability. How easy it is to implement these things. Medical imaging benefits from the huge amounts of data already in radiology departments, so AI training is more straightforward.
Makes sense.
And virtual health assistants, super accessible via smartphones, right? They can be deployed pretty quickly and cost-effectively.
So it sounds like some applications are further along than others.
Definitely.
But even for the ones that are still in early stages, the potential's still there.
Oh, absolutely. Take drug discovery. It's more complex, it's expensive, but the potential to accelerate, the development of life-saving therapies, it's huge.
It's mind-blowing to think AI could transform every stage of healthcare, from diagnosis to treatment to ongoing management. It's easy to get lost in all the tech talk, but what I'm really interested in is how all of this impacts the patient, the actual experience of healthcare.
Yeah, for sure. Cordero touches on that. He says one of the biggest shifts is going to be, going from reactive care to proactive health management.
Okay, so what does that actually look like?
Well, right now, we usually go to the doctor when we feel sick.
Yeah, when something's wrong.
But with AI, imagine identifying potential issues before you even have symptoms.
So catching things super early when they're easier to treat.
Right. Think of it like taking your car in for regular maintenance.
Okay. Yeah.
You change the oil, you get a tune-up, so you avoid major problems later, right? AI could help us do that with our health.
I like that analogy.
Yeah.
A proactive approach to your own body.
Yeah.
And what about, improving diagnoses?
Oh, that's another area where AI is, really promising.
Yeah.
Imagine algorithms analyzing medical images, lab results, helping doctors make more accurate diagnoses.
So it's like a second opinion from, a supercomputer.
Pretty much.
Yeah.
Especially helpful with those tricky cases, or conditions that are hard to diagnose. Early and accurate diagnosis can be the difference between, everything.
It adds an extra layer of confidence, I guess.
Exactly. And let's not forget how AI can empower, patients to take charge of their own health.
Oh, right.
Those virtual health assistants, they can provide personalized advice 24/7.
I use chatbots for, customer service and stuff, but I never thought about them for health.
Oh, it's growing fast. Imagine asking a virtual assistant about a symptom,
Yeah.
right? Or getting medication reminders.
Like a pocket-sized doctor.
In a way, it
Hmm.
could be a game changer for people who have, trouble accessing healthcare or just want to be more involved in their own, health journey.
Totally. It seems like AI could make healthcare more um, accessible for everybody.
Absolutely. More convenient, more personalized. But like with any new tech, there are challenges.
Right. Cordero brought up some of those. What are the biggest hurdles?
I think making sure AI is used ethically and responsibly, right?
So what does that look like, practically speaking?
Well, data privacy is huge, right?
Hmm.
AI needs data.
Yeah.
We've got to make sure that information is protected, used appropriately.
It's a big responsibility.
Totally. And then there's bias. Algorithms are trained on data. If that data is biased, the algorithm will be biased, which can lead to, unfair or inaccurate results.
That's a big one. How do we make sure these algorithms are trained on like diverse and representative data?
It takes a multi-pronged approach. We need data from all sorts of people, and we need ways to, detect and fix bias in the algorithms themselves.
It's like making sure AI has a good education,
Yeah,
free from prejudice.
exactly. And then there's the problem of integration. A lot of hospitals, they still use outdated tech.
Trying to fit a square peg in a round hole.
Exactly. So we need investment in infrastructure upgrades. We need interoperable systems so AI can, talk to existing technology.
So it's a lot of work.
It is, but also huge potential for positive change. And finally, cost and accessibility. AI can be expensive. We need to make sure it's available to everyone, not just the wealthy.
Right. We don't want it to create even more disparity in healthcare.
Absolutely not. We need creative solutions, maybe public-private partnerships, subsidies, make it affordable for everyone.
So it sounds like AI has this incredible potential to like totally revolutionize healthcare. But as we've been saying, it's not all sunshine and roses.
Yeah, definitely not a quick fix. Integrating it responsibly, ethically, it all takes a lot of careful thought and action, right? We have to address these challenges we've talked about.
Absolutely. As we're, wrapping up this deep dive into AI and healthcare, what do you think a successful future with AI actually looks like? Like if you had to pick one top priority, what would it be?
Ooh, that's a tough one. But for me, it all comes back to access. Equitable access to these advancements. We've talked about all the amazing potential, right? Personalized medicine, early detection, better diagnoses, but it's got to be for everyone, right? Not just a select few.
Yeah, I totally agree. Access to good healthcare, that's a basic right.
Yeah,
We can't let AI make those inequalities even worse.
exactly. We've got to be so careful about bias in those algorithms. We need solutions that are truly inclusive, that benefit everybody.
So it's not just about the tech itself. It's about how we use it. Make sure it's ethical, responsible, all of that.
Exactly. The future of healthcare, it's being shaped right now. And we all have a part to play in making sure AI is a force for good.
This has been such a thought-provoking conversation. I feel like I've learned so much, and I'm sure our listeners have too.
Me too. It's been a great discussion. It really is a fascinating field. Can't wait to see what the future holds.
Okay, well, before we go, any hints about what you're exploring these days? What's
Yeah.
next on your list?
Well, there's always something new to learn, isn't there? But lately, I've been really diving into the whole AI and climate change thing. It seems like there's so much potential there to, make a real positive impact.
Ooh, that sounds like a deep dive I don't want to miss. I'm already adding it to my list. Stay curious out there, everyone, and we'll see you next time for another deep dive.
Absolutely. Keep learning, stay engaged in these crucial conversations, and we'll see you soon.